Hello friends. Today we are going to discuss about alcohol use disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMHANS, Bangalore. As you know, across the world there are two important classificatory systems. One is by WHO, called as International Classification of Disease, and currently the 11th edition. Another one is by American Psychiatric Association, called as DSM, that is Diagnostic and Statistical Manual of Mental Disorder, currently the 5th edition. This alcohol use disorder was given by American Psychiatric Association. This was an intelligent move by the American Psychiatric Association to bring all the disorders which related to alcohol use under the rubric term called as alcohol use disorder, because they consider it as a spectrum which starts with a mild form to moderate and severe alcohol dependence. Here, the Americans have clearly abandoned this stigmatizing word such as addict, addiction, dependence, abuse. Those words have been removed completely. They brought it under the condition called as medical disorders. Since all these disorders comes under scientific medical condition, hence they call it as an alcohol use disorder. Hence this term, alcohol use disorder, which has been widely accepted across the world. But however, ICD-11, though it considers it as very accepted by across the world, it continues to use the word alcohol dependence syndrome. But for the purpose of primary care and also in the general hospital psychiatry, the best would be to adopt alcohol use disorder, which is very simple, easy to understand, and easy to implement. At the same time, it takes care from the problematic user to the dependence pattern. Here, as I mentioned, it starts with the mild disorder to the severe form. As per the available literature, it clearly says 3/4 of the alcohol use disorder patients have visited the primary care physician in the past 1 year before they developed severe alcohol use disorder. That means we can recognize this in the primary healthcare center only. And most of the 85 to 95% of these alcohol use disorders can be easily managed at primary health care. Let's understand the prevalence. The prevalence of alcohol use disorder has been found to be 5% as per DSM-V. But the Indian study, a landmark study which was done by All India Institute of Medical Science by Atul Ambedkar and his colleagues, this study clearly reported there is 5.7 crore people are having a problematic alcohol use and 2.9 crore are dependent. Dependent means nothing but addiction. That means we are talking about a huge number. A huge number of 2.7% of our population is addicted to alcohol. Although this word addiction can be considered as stigmatizing, but for the purpose of understanding, let's understand it as a addiction means the person who is dependent on alcohol. Here, it's not just the 2.9 crore individuals who are suffering. Along with the 2.9 crore people, 2.9 crore families are suffering because of the alcohol use. And there are above 5.7 problematic alcohol users are also there. Now let's understand what is this alcohol use disorder as per DSM-V. DSM-V is very clear. Out of 11 symptoms, only 2 symptoms are required over the past 1 year to diagnose as alcohol use disorder. And these symptoms can be in combination. All these 11 symptoms can be categorized into 4 groups. Group A, B, C, and D. Group A is impaired control over the substance use. Group B is social impairment. That means he has problem in social situation. Group C is risky use. That means taking alcohol and driving. Group D is pharmacological implications. So let's discuss about each group. Group A talks about impaired control over substance use. That means here the person has lost control over the substance. He spends more time for consuming alcohol, or he wants to consume very less amount, but he ends up taking more. At the same time, he wanted to limit or stop the alcohol use, but he is unable to do. That is the second criteria. Third one is spends a significant amount of time obtaining alcohol, drinking alcohol, and recovering from the alcohol consumption. That means is out of 24 hours, most of the time he's either searching for alcohol, either drinking alcohol, or he is in an intoxicated state. That is the third. Fourth one is he has a craving. He cannot stop it. He wants alcohol. So these are the four important symptoms under the impaired control. Let's look at the social impairment. Because of the use of alcohol, he has problems at home, school, and even at the work. It is not once or twice, it is a recurring problem. That is the fifth symptom. Sixth, there is relationship issues because of alcohol use. He is fighting with the family members, friends, relatives. So this is another important criteria. And he has given up or cut back on enjoyable activities. That means if he has pleasurable activity such as playing with his child or else playing golf or watching movies, he has given up them. For him, all his life or all his activities revolves around substance use. It is also called as salience. Coming to the C, risky use. Here, he continues to drink alcohol in spite of being in physically dangerous situation like drinking and driving, unprotected sex, or else he is going to job under the influence of alcohol. Imagine he is a doctor performing surgeries under the influence of alcohol. They're all risky use. At the same time, he also has harmful use in spite of using alcohol and having harm to him or psychological harm he is having because of alcohol use, but still he continues to have. The doctor has said that he has liver problems because of alcohol use, but he is unable to stop it. He is having multiple ulcers, but still he continues to drink alcohol. That means harmful use is there. That is, physical and psychological harm is there, but he continues to drink alcohol. Coming to the last part, that is pharmacological. Here, the person becomes tolerant to the substance. That means, in spite of taking alcohol, he does not get the kick. To get the same effect, he has to take more amount of alcohol. In simple word, if a person has started drinking with 1/4 of alcohol, over a period of time, maybe after 1 year, he requires around 3/4 to get the same kick. After 3 years, he requires around 5/4 to get the same kick. That means there is tolerance. His liver enzymes have induced. He requires more amount of alcohol to get the same effect. And he suffers from withdrawal symptoms within few hours or days after stopping the alcohol or reducing the alcohol. That means he has withdrawal symptoms. So these are the 11 important symptoms, out of which if there are 2 is there in the past 1 year, then alcohol use disorder diagnosis can be made. To summarize, 11 symptoms are craving. The person starts drinking, he has craving. Because he is drinking, he has tolerance. He has to take more amount of alcohol to get the same kick. If he doesn't take, he has withdrawal symptoms. Hence, he spends most of the time taking alcohol and he has neglected all his other pleasurable activities, that is salience. He spends most of the time procuring alcohol, drinking alcohol, or under the intoxication. He is unable to control the amount of alcohol use, the time spent on alcohol use. He is unable to stop it. He is unable to cut down the alcohol. Harmful use is there. Because of the alcohol use, he has physical problems. He has health problems. He has psychological problems, but still he does not want to quit, or he is unable to quit. Because of alcohol use, he has impairment at work, relationship issues. So that means he has a serious problem. Along with that, he has relationship issues. Using alcohol in a dangerous situation, that means drinking while driving, or else on the job he is drinking. So out of this 11, if there are 2 symptoms are there, then we can diagnose as alcohol use disorder. But however, If there are 2 to 3 symptoms, it is mild. If it is 4 to 5 symptoms are there, we consider it as moderate alcohol use disorder. Anything about 6 or more symptoms is there, it is severe alcohol use disorder. More the number of symptoms, more severe is the alcohol use disorders. However, there are course specifier also has been mentioned. Here, if the person has stopped alcohol for past 3 to 12 months, is considered as early remission. If it has been over 12 months since the person has met with the alcohol use disorder, that means partial remission. In controlled environment means the person does not have access to alcohol, he is in the rehabilitation center. Then we call it as in controlled environment. So these are the core specifiers as been mentioned for the diagnosis. Now the question comes, how to do the assessment? Let's talk about the structured assessment. For a busy primary care practitioner, the simplest way to make a diagnosis of alcohol use disorder is by using AUDIT. AUDIT is a concise format of assessing alcohol use disorder. There are only 3 items. The original had 10 items. What are those 3 items which should be there, which should be asked for any person who is visiting primary health care center? First one is, how often do you have drinking or consuming alcohol? In a simple word, how often you are drinking? The response, if it is never, monthly once, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week. Next question is, how many standards of drinks containing alcohol do you have on a typical day? This is another, it is basically looking at the quantity of alcohol. How often do you have 6 or more drinks on an occasion? That means it's 6 standards means 1 standard is 30 ml of hard liquor. 6 comes into 180. That means how often in the past month or in a week he is using more than 1 quarter per day. If he has scored 4 or more, that means he requires help, professional help. For a woman, if she has 3 or more, then it is considered as positive. Instead of this AUDIT, there is one more important questionnaire, CAGE questionnaire. That is, C stands for cut down, A for annoyed, G for guilty, and E for eye opener. This CAGE questionnaire is a very simple, easy to use in primary healthcare centers. What are those 4 questions? First one is, have you ever felt you should cut down on drinking? That means in the past few years, anytime you felt that you should decrease the alcohol consumption, that is cut down, that is C. Have people annoyed you by criticizing your drinking? Ask him, are people criticizing you because of your alcohol use? That's the simplest way of asking. The third one is, have you ever felt bad or guilty for drinking? That is the other one. Fourth one is, have you ever had a drink first thing in the morning to steady your nerves or to get rid of our hangover? That is eye opener drinking. That means as soon as he gets up, he requires alcohol. So in the CAGE questionnaire, cut down, annoyed, guilty, and eye opener. So if there are 4 criteria, if you are there, in that if you are going to say yes or no, 0 for no, 1 for yes. A total score of 2 or greater is considered clinically significant. Higher the score, worse is the problem. That means maximum score is 4, minimum is 0. Every item should be scored yes or no. So that is CAGE questionnaire, my dear friends. Now let's discuss about the management of alcohol dependence or alcohol use disorders. First and the foremost is investigation and general physical examination. Do a thorough general physical examination. See whether the person had any head injury, any bodily injury, Does he have any icterus? Does he have any pancreatitis? Does he have any jaundice? Does he have any hemogram problems like hemoglobin deficiency? If those need to be considered under general physical examination, and also check whether he is intoxicated at this point of time. Then get the basic investigation done, such as hemogram, liver function test, renal function test, RBS, and electrolytes. Random blood sugar is also to be done. Based on the other comorbidities, whether he has diabetes, whether he has hypertension, whether he has cardiac disease, or else any other disease, you need to consider those investigation also. Let's discuss about the treatment. The treatment, there are two important things. One is short term, another one is long term. Let's discuss about the short term. Short term is detoxification. That means detoxification is aimed to decrease the withdrawal symptoms. Here you can choose either the long-acting benzodiazepine or else short-acting benzodiazepine. Long-acting such as diazepam or chlorodiazepam can be considered. Short-acting oxazepam or lorazepam can be considered. You need to choose this medication based upon whether there is a liver function impairment or not. If there is an impairment in liver functioning, then you need to consider oxazepam. You should not consider long-acting such as diazepam or chlorodiazepam because already there is a problem in the liver. And if you give long-acting like diazepam or chlorodiazepam, it will tax further on the liver. Hence, the choosing the benzodiazepine is a very crucial here. If the person does not have any comorbidity, please go ahead and choose long-acting diazepam. That is, the long-acting will be very useful because if you give once daily medication or maybe maximum twice a daily medication, you can control the withdrawal symptoms. Suppose you are giving the short-acting medicines. You need to give multiple times a day. Hence, if there is no comorbidity, please either choose diazepam or chlorodiazepam. Further, there is something called as long-term relapse prevention. You have done the detoxification over a period of 2 to 4 weeks. Now you have to think of relapse prevention. For long term, you can consider giving disulfiram, naltrexone, or acamprosate. Let's look into the medication dosage. For example, there are 3 types of dosing. One is fixed dosage. You start based upon the number of units he is taking. Either you can start 15 mg to 30 mg of chlorodiazepam 4 times a day, or else you can consider 10 to 20 mg of diazepam 4 times a day. So you will be giving somewhere around 40 to 80 mg of diazepam. It is a fixed dosage. But however, fixed dosage may be attractive for primary healthcare center. But however, every person, based upon the number of years of alcohol use, the amount of liver damage, the medication needs to be titrated. Hence, the best method would be symptoms-triggered dosing. That is, choosing diazepam 10 to 20 mg per administration. That means if a person has withdrawal symptoms, give 10 to 20 mg of diazepam and then see whether he has withdrawal symptoms. If he does not have, then wait for another 12 hours, then repeat the medication. If he has a withdrawal symptoms within 3 to 4 hours, repeat again 10 to 20 mg. That is symptom-triggered dosing. The last one is front-loading dosing. That means you will be using both fixed dosage and also symptom-triggered. You will start the medication at 30 to 40 milligram as a loading dosage. After that, you will be giving the medication as and when symptoms are triggered. Hence, before you start the short-term treatment, you need to give thiamine. It may be 100 mg or else 250 mg thiamine parental route should be given over a period of 3 to 5 days. So, thiamine for orally should be considered for next 3 months. Supportive treatments like IV fluid, gastritis management, electrolyte imbalance, head injury or bodily injury should be taken care. Then now coming to the long term, You have done the detoxification. Detoxification usually runs for over a period of 2 to 3 weeks. If the person has protracted withdrawal, you may have to continue over a period of 1 month. After 1 month, you will consider long-term management. That is, either you will choose acamprosate or else disulfiram, naltrexone for at least 1 year. What is the dosage of acamprosate? You will consider giving 1332 milligram per day if the person has less than 50 kg. You will give almost 2 gram per day if he is more than 50 kg. Suppose if the patient says, I would like to take disulfiram, which is very economical and considered to be very effective in Indian population, you give 250 mg per day. However, you need to explain the patient, when you are taking disulfiram, if you take alcohol, there will be a reaction and you need to come to the hospital for treatment. The treatment is only supportive treatment. Coming to the third, if he refuses acamprosate and disulfiram, you can consider naltrexone. That is 50 mg per day, but it is costly treatment which will cost you something around 30 to 50 rupees per day. However, compared to alcohol price, naltrexone is definitely cheaper. And this long-term treatment should be continued at least for 1 year. Further, a person who is taking alcohol will have family issues. He will have individual problems. Hence, family therapy and individual therapy need to be considered. To conclude, my dear friends, alcohol use disorder is very common, that is up to 5%. But Indian population, it is around 3.7%. And 95% of them can be treated at primary healthcare center on OPD basis. Only 2 to 3% requires ICU care if they have seizures or delirium tremens. Alcohol use disorder is a chronic, recurring, relapsing and remitting disorder. Hence, prepare the family for a long battle and also encourage them to bring them whenever he starts drinking. That means whenever there is a lapse. Here, please understand, alcohol use disorder is similar to diabetes or hypertension. Hence, the person who is going to be dry, the person who is going to come out of alcohol dependencies, the person who is in constant touch with the treating team. That means a good outcome. Important factor is, if the person is coming regularly for follow-up, there is high possibility in the next couple of years he is going to stop alcohol use. Hence, the long-term treatment should be decreasing the relapse. Alcohol use disorder is a lifetime diagnosis. It is simply difficult to cure. Prepare the family for relapse. Ask them to bring the patient as soon as he takes the first alcohol. So, my dear friends, alcohol use disorder at this point of time in India is at the epidemic state. It is almost 3%. We need to engage the patient and the family in the treatment. It is not just 2.7 crore people are suffering from alcohol use disorder. It is 2.7 crore families are suffering. That's a huge number. Hence, my dear friends, please inquire about alcohol use in primary healthcare center. Use CAGE questionnaire or AUDIT and rate them. And every patient should be asked, because 30% of the primary healthcare visitors will have alcohol use disorders. Thank you very much for giving your valuable time. Stay safe.